Hello and welcome to the taster session in mental health. Obviously mental health is a huge area, and what we hope to do during this taster session is just to give you a little sample of the different things that we offer on our full courses. I hope you find this session useful. As I say, it's a bit of a whistle-stop tour, but it will give you a little bit more of an insight into mental health. So let's look at what we're going to cover on the actual course itself. We're going to look at the term mental health. What does it actually mean? Aware of the causes of mental illness. As you can see, there's one word difference between the two, mental health and mental illness. Understand the various types of illnesses and their symptoms. So we're going to look at a few of the symptoms as well. Now, physical health is something quite easy to see. We can quite easily see when somebody is physically unwell or not healthy. We talk about healthy lifestyles, and a lot of the time we are relating to the physical side of things. The way we've described it on here is that mental health is a state of well-being. It's an ability to cope with the stress of daily life, and people who are mentally healthy are said to play an active role with family, friends and the community. From that, what we're not saying really is that mental illness means the opposite of that, so people can't play an active role with family, friends and the community. But when somebody is mentally healthy, that's what we're saying that they can do in life. It is quite there's a lot of stigma attached to mental health. It's a lot better than it was in the past, but we've still got a long way to go before we get to the stage where it's accepted completely, and there shouldn't be any difference. At the end of the day, it is a condition. If somebody has a mental illness, there's something wrong and they need some help with it. So looking on the back of mental health, right, so let's start looking at mental illness. The statistics that's been around for a few years now say that mental illness affects 1 in 4 people at some point in their life. Now that figure has been about, as I say, for a few years now. I feel personally that there are people out there living with a mental illness who haven't gone to a doctor and haven't been diagnosed. So if anything, I feel that the figure's actually higher than that. But we'll sit with that figure at the moment. And on the back of that figure, 3 out of 4 people know somebody who suffers from a mental illness. So at some point in our lives, chances are that we might suffer from an illness ourselves, or a relative, or family member, or friends may also suffer from an illness. So it is very, very common, and that's why it's important to understand the different illnesses themselves. When we talk about the illnesses, we can see on the next point there, there's over 300 recognised manifestations of mental illness. That's a lot, obviously, and that is the different types of illnesses, and they're very, very different illnesses as well. So we look at a few on this taster session, but on the main course itself we go through quite a lot of the main ones that we come across, but there is over 300 there. We also cover about the classification systems and the diagnosis systems, which will help you understand where you can look for information about all of the different illnesses. Now the last 2 points on there I think are quite linked. Women are more likely to be treated for mental health issues than men. British men are 3 times more likely to commit suicide than women. I think there's still quite a macho thing about men. They don't go to a doctor. They feel that they can cope with things. They'll just go on. Don't worry about me. I'll manage. They don't like admitting that there's a problem, and I think that's why those statistics are there. At the end of the day, a mental illness is something that people need help with. It's something that people need treatment with. Could well be a chemical imbalance in the brain, something that they need support with. So I think that is why, if you don't go to a doctor and you don't seek the treatment, 3 times more likely to commit suicide than women, that's quite a big statistic. I personally think that's the reasons behind it. Okay, we'll move on from this one. Right, so I mentioned before that there's over 300 types of mental illness. This list here gives you a few of the main ones that you'll come across. Definitely the biggest and most common illness that you'll come across is depression. When we talk about depression, we're talking about clinical depression. Everybody has up and down days, that's quite normal, but we're talking about people who are clinically depressed. Very, very detrimental illness. So we've got depression, anxiety, one that people usually miss. Again, it's normal to feel anxious in life, but this is when the anxiety takes over your life and you stop doing things because of the anxiety. That's when it becomes a mental illness, so that's on there as well. Obsessive compulsive disorder, usually called OCD. This one has actually come to the forefront a little bit in the past few years. There's been a few programs on television about OCD which have helped improve the awareness. Now, when we say OCD, the thing that people automatically think of is cleaning, having everything organised, not wanting anything out of place, can't cope with mess. Maybe germs is part of it as well. That is a very common symptom of OCD. But OCD also covers more than that. It's repetitive actions. It's doing things without having an actual reason behind it. So it's like a ritual thing. Things like turning the light switch off and on 10 times, locking your door 5 times. There's a lot of timings usually. And if you ask somebody why they do these things, usually they will say that the feeling is that if they don't do it, something bad's going to happen. And that's the treatment for OCD, is trying to combat those fears, trying to face them and realise that that isn't actually true. But OCD can be a very, very detrimental illness. It can be an awful illness to live with, and very, very different forms in it as well. But as I say, the most common one you'll come across is the cleaning side. And there's actually been a programme on TV recently about the OCD cleaners, which did quite a lot to sort of show it in a good light. But OCD does have many, many manifestations. Dementia comes under the mental illness banner, and this one is covered in our other courses, which are specifically in dementia, because it's a very big topic. So we look at that in a different session. Schizophrenia, personally, I feel is the most misunderstood out of all the illnesses. Just like to point out that schizophrenia is not multiple personality disorder, completely different illnesses. But schizophrenia is quite misunderstood, and one that we do cover on the main course itself. Bipolar. Bipolar used to be called manic depression. It's now called bipolar, or bipolar affective disorder. There's quite a few celebrities who have done quite a lot of work in raising the awareness of bipolar. And as I say, it's manic depression, but we'll go into a bit more detail in a moment. Phobias. Everybody has a phobia. I've yet to meet anybody who doesn't have a phobia or something, and it's quite normal. However, there's certain phobias like agoraphobia that affect people's lives in a big way, and not leaving the house because of the fear of the outside and things like that. So again, it comes under the mental illness banner and something that can be helped with. Eating disorders do come under the mental illness banner. Anorexia, bulimia, eating too much, eating too little, does come under the mental illness banner. Post-traumatic stress disorder, PTSD it's usually called. Very, very similar symptoms to depression, but usually caused by a specific traumatic event, and is usually coupled as well with flashbacks. Seasonal affective disorder, usually called SAD. That one again, very similar to depression, but only affects people at certain times of the year, and it's down to the lack of sunlight. So that's one again that's come out to the forefront in the past few years. Wasn't really talked about before then. And the last one on this list is personality disorder. Now those two words are, that's like a heading really for a lot of different personality illnesses. And that's where you'll find underneath that banner the multiple personality disorder. That one is again a huge area which we do go into a bit more detail on the main course. But it is really a heading, is personality disorder. But you will hear that term used, certainly if you work in mental health. As a diagnosis, somebody will say personality disorder, but it's about understanding what personality disorder it is that the person's got. Okay, we're going to pick 3 out, and we're going to go into a little bit more detail about those 3. And the 3 that I've picked out for the purpose of this taster session are depression, OCD, and bipolar. As I say, depression, that's when we're talking about clinical depression. And when we're talking about clinical depression, there's an imbalance in the brain. It's not producing enough of the right chemicals, and that's what's making somebody feel so low. The symptoms of it are low mood, sleeping too much, sleeping too little, eating too much, eating too little, with severe depression, we can have suicidal ideations, very, very common illness, and one that can be treated through medications, through therapy, through counselling, all these different things. Lifestyle changes can help deal with depression, and as I say, very, very common illness. Now, OCD, I did discuss a little bit on the previous slide, and I think, to be honest, I've covered that in as much detail as I can do. But with OCD, it is very detrimental, and it's such a huge area. It's not just about the cleaning, it's about more than that. You know, it can be anything. It can be a certain colour that people are attached to, and everything they have or buy has to be a certain colour. It could be that it's a physical side of everywhere they go forwards, they have to go backwards the same steps, won't touch door handles, things like that. Now, bipolar, as I said on the previous slide, there's a lot of celebrities come out. I think the one of the best ones to look at for information is Stephen Fry, because he's got a very good insight into bipolar, and talks about it really well, about how he's lived with it and how he's coped with it over the years. But it used to be called manic depression. And if we look at those two words, manic, depression, it's two extremes, and bipolar means that it's two opposites, two extremes. And it's either somebody's feeling elated and fantastic and great about themselves, they think they can take on the world, they can do anything, very, very motivated. And then at the end of that, there's the down period where they will go lower and lower until they're in depression, and that goes to severe depression as well. And they're living a life that's just going up and down and up and down. It can be a very hard one to treat at certain stages as well, because you're trying to treat somebody who's very elated to bring them down a bit, and then you're trying to treat them for depression to bring them up a bit, and it's a bit of a balancing act, but one that can be managed really well once you get the right treatment for them. Also with bipolar, when people are feeling elated, you know, they feel good about themselves. The negative fact about that is, because they're so motivated, they won't sleep for maybe 2 weeks. You know, they'll spend all of the money and things like that, and then when they do get the depression, they realise what they've done when they were elated. So it's quite a hard one to treat. And when somebody is elated, and say you did feel fantastic about yourself and you can do anything, why would you take medication to bring you down from that? It doesn't make sense to you when you're experiencing that. And that's when we talk about insight, it's about the person understanding the illness, understanding the symptoms, understanding the triggers, what to look for in themselves to try and combat it, to try and live with it, and realise the damage that can be done when that elation period happens. So we've just picked 3 out there, and we've just given a little bit more detail about those 3. As I say, on the main course we're going into a lot more detail, but I do think it's about having an understanding of these illnesses, and the fact that there is stigma attached to some of them, and understanding that stigma isn't relevant, it's not needed. People don't understand a lot of these illnesses, and if they don't understand something, it's usually a natural reaction to sort of push it away or think it doesn't exist. With like depression, people don't think depression exists. It's pull yourself together. As I said before, when somebody's depressed, then there is a chemical imbalance in the brain and they need help with it. Okay, so now we're going to look at the causes. Now, there are a few different causes to mental illnesses, but what I wanted to do on this taster session is just focus on one for now. And this, if you type into Google the stress vulnerability scale, you will find this information, but not quite in this format. And I think this format really helps to get the message across. If you think about yourself, this is your coping bucket. This is in your head. This is in your brain. This is what you can cope with. And it's empty at the moment. Now, as we go through life, we have stress. I've never met anybody who doesn't have stress or stress about something. It's quite normal to have stress. The sort of stresses we talk about are money, relationship, work, bereavement, transport. It can be anything. And what these stresses do is they start to fill this bucket with this stress. And the bucket gets fuller and fuller over time until it's reaching the top. And it's just very near the top, not quite overflowing yet. And something happens, maybe a minor stress, maybe a very small one, like I can't find my phone, where did I put it? And then the next minute the person's screaming and shouting and I can't cope anymore with life. And maybe the loved ones stood there looking at them saying, it's just a phone, stop overreacting. And that's when I think this way of explaining things comes into its own. Because what's happened at that point, yes, it was a small stress, but it's added to that coping bucket and it's caused it to overflow. At that point, there's a problem, there's an issue, they can't cope anymore. This is when people need support and need help. And that overflows. And the other thing to mention is when somebody is suffering from a mental illness already, then the bucket's usually smaller, so the coping level is usually lower. So it's important that we realise this and we deal with things as we go through life. If we put them in this bucket and we leave them there, it will just get fuller and it will reach the top and overflow. So there's various ways of sort of controlling our lives, of emptying this now and again to make room for more stress, because I don't think it's possible to stop stress. But there is ways of sort of just literally talking about things, getting things off your chest. We'll empty it a little bit and pass it on, and then you can start filling it again. And also, I think this works well with the phrase bottling things up and sort of burying your head in the sand, not coping with things. It's there, it's in the back of your head, it's in this bucket, it's starting to fill. We might not feel like we've got that stress, but it's there. And that's why it's best to deal with it as we go along to make sure we've got space for more stress, because unfortunately stress does happen. Certainly in the world we live in at the moment, can be stressful at times with the depression and financial problems, work problems. There's a lot going on, and it's important to make sure that we're dealing with these things as we go. And if we don't, and the bucket overflows, then that's when we need support, we need help. There's a problem there. Mental illness might be apparent at that point. So I think this is a really good way of showing the cause of mental illness. There are some other causes out there as well that we talk about on the main course. Things like, is it hereditary? Is it substance misuse? Whether some substance misuse is a trigger for a mental illness, or whether it's a way of coping with a mental illness. Which one of those is it? So there is quite a lot covered on the main course itself. So what we've done there is we've given a quick whistle-stop tour of a few areas of mental health. Now, on the main course, we do cover a lot more than that. We'll go into a lot more detail about things. But I hope that this taster session has just given you a little bit of a brief insight into mental health. It is a huge area. It's one that I've worked in for quite a while now, and I love talking about mental health. I love raising awareness and challenging people's views when there may be negative views. But it is, the more understanding we can get, the better life will be for ourselves and for people living with mental illness. It shouldn't be any different than a physical illness, and we should talk about it. We should be able to approach people and say when we're having problems, say that we feel depressed today, but we're coping, we're getting on. It's all about, just remember that coping, the coping bucket in the brain, and just trying to manage days as we go. So I hope you found this useful. Please feel free to ask any questions that you want to. Just email me through any questions, and I look forward to speaking to you again soon. Thank you.